Hi, Chantel.
Hi.
How are you doing?
Oh, okay.
Yeah. I'm just gonna introduce myself again. My name is Gavin. Today I'm gonna be your student physio. And based on the assessment we have already done, is that okay if I talk to you about the assessment and continue to our treatment?
Yeah.
Yeah. You can withdraw your consent if there's any discomfort or too painful. You can withdraw your consent anytime you want. Okay. Do you have any questions before? Okay, so based on our assessment, I know you're kind of cautious about moving, you're kind of scared about it. I'm just gonna give you a little education piece that our spine is actually built very strong it's actually built to be bending in all directions and loading. So I know you have some discomfort, you have kind of excruciating pain right now. But we actually want to encourage you to do more exercise, to do more activities in the safe dose. So not only it will bring better circulation, which can speed up your healing process, but also just the general movement will break that vicious cycle where you just trying to hold yourself in a safe position.
Okay.
Yeah. So we definitely encouraging you to do more exercise, stuff like that. Okay. And also based on our assessment, we have already ruled out any red flags that would impeding you from doing the movement. So based on that standing point, we think it's pretty safe for us to do movement. And since you have the acute exacerbation on the back pain, we're gonna do a treatment trying to alleviate the pain a little bit. Is that okay for you? Yeah, and you may lay on your side for that. Yes. And just reset the back. And that while this treatment while involving me using my hand palpating your spinous process on your lower back and then moving your leg around. Is that okay for you?
Yeah.
Yeah, and is that okay if I roll up your shirt a little bit so you can feel?
Sure.
Okay, really good. And I'm gonna scooch it like this, and are you able to scooch towards me a little bit closer? And now you can put your upper body back to that corner. Just a tiny bit. Really good. Are you okay? Is it comfortable in this position? Sorry, I didn't get you a pillow.
No worries.
Okay, and now we're just trying to get you some passive range of motion in extension. So we know that extension is a little bit painful for you, and we're just trying to get it moving a little bit. Okay, is that feeling okay?
Yeah, it feels great.
Just trying to alleviate your pain, so I'm not really go to the end range, but just trying to get you some movement like that. How is that feeling?
It feels great. Yeah.
Good. Okay. Okay, let's stop there. And now you can lay on your back. Okay. So I know back home, like obviously you don't have somebody to always do this to you. So I'm going to teach you a technique which you can do it on yourself to alleviate the pain when you are feeling the pain.
Okay.
You can do this technique every 2 hours, holding it up there for 10 to 20 seconds, and then when you are feeling fatigued, you can go back and come back to it.
Okay.
Our main goal is just to alleviate the pain, so there's no specific time length that you have to do it to.
Okay.
So that will be, I'm just gonna give you some introduction by pulling your knee towards your chest. And then you have to use your hands to pull on the knee. Yeah, you don't have to pull it too close.
Okay.
As long as you are feeling that lumbar spine having a little bit stretch and the pain goes away a little bit, that will be a good extent to stop.
Okay. Yeah, that feels really nice.
Yeah, and it's a static movement. Means like you're just holding it there. You don't have to fight for anything. You don't have to move.
Okay.
Yeah, and you're just holding there until you feel like the pain goes away, or at least alleviate a little bit. Okay, your form looks really, really good.
Thank you.
now you can relax. Okay, now it looks like you're already overcome the excruciating pain. We're gonna do some technique to actually getting your joint moving a little bit for you to be able to get to that extension movement that you're having trouble with.
Oh, okay.
Okay,
Yeah.
so by doing that, I will have to ask you to go towards me again. And you can just lay there comfortably, and I will give you introduction. I'll give you an introduction to move your body. Is that okay if I tuck in?
Yes.
Again, I'm gonna palpate the T12. And is that okay if I ask you? Oh, first and foremost, I'm just gonna pull on your arm to lock the upper spine, and I'm gonna ask you to hold your own elbow. I'm gonna scooch my hand in there. I'm gonna ask you to bend the upper knee and straighten the lower knee. Okay, is that feeling okay? I'm gonna roll you towards me a little bit. Okay, and I'm gonna try to put my elbow right below your hip bone. Is it too much pressure on you?
No.
Okay, I'm gonna move it upwards. What's the pressure? Is it too much?
No, it's good.
Okay. Now you can sit up for me.
Okay.
I'm gonna lower that. Okay. Whenever you're ready, you may stand up.
Okay.
And we're gonna see if you're actually be able to go back a little bit more. Or you can put your hand on here
Oh, it's better.
and slide back. Yeah, it looks like you are gaining.
Magic.
Yeah, it looks like you are gaining some range of motion over there. And is there less pain also?
Yes.
Okay, great.
Yeah. It feels way better.
That's really nice. Thank you so much. And last but not least, we want to give you something. We'll give you some homework for you to
Okay.
do to improve your functional capability
Okay.
of bending down and grabbing stuff, because from your history, it sounds like you have some trouble just bending down and picking up stuff from the floor, hey?
Yeah.
So we're just gonna, because now you have so much pain in your lower back, we will teach you a way where you can do it safely, so you will be less cautious, you will be less worried about going down to that movement, okay? So with that, I'll just demonstrate first. This is an exercise where you want to put your hand in the front of your thigh, and instead of directly bending from the spine,
Okay.
I want you to push your bum back while sliding the hands down to your leg. And you're gonna remain in a neutral spine position. You can actually sort of stand up and step one step forward. Yeah. So firstly, so make sure you're bracing the core,
Okay.
and then sliding your hand down to your leg, pushing your bum back as low as you can. And when you feel like you are reaching the bottom where if you keep going, your lower spine will have to curve. Then
Okay.
you start to bend the knee.
Oh, okay.
Exactly. And then you go back up. So is that feeling less
Yeah.
worried about your lower back?
Yeah.
Yeah. So you can start to do it really slow and really focusing on your form to not over slouching, but instead engaging your glute muscles. And you can try it for a few times. But at home, you will just do it. Try to do it 8 to 10 times, 8 to 10 repetitions, around 2-3 times a day, if it's doable for you.
Yeah.
Do you think
I
that,
can
that would be a doable amount?
Yeah, I could definitely make that work.
Really good. That looks really good. Really good form. How do you feel on your lower back?
Way better.
While you're
Yeah,
doing
way
that?
better. Now I can pick
Yeah.
myself up forward.
Nice. So we'll firstly practice that, and that's not necessarily means when you curve it's an unsafe position, but since you have the pain right now, we want to train your muscle to breathe a little bit harder, just so you don't worry about picking up stuff from the floor while strengthening your glute muscle.
Okay.
Okay,
that makes
thank you so
sense.
much for
Thank you.
participating.
Thanks.
Thank you.